praise. Hallelujah. Give him the highest praise. Hallelujah. Give him the highest praise. In the morning when I wake up, in the night when I wake up, I will lift up my voice to heaven and give you the highest praise. Hallelujah to my King. Hallelujah to my Father. Hallelujah to my Jesus. I bow before the throne. When I look at all the wonder and I see all the creation, the beauty of the universe, you never change. You never lie. You never change. You never change. Hallelujah to my Jesus. Hallelujah. 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 Give him hallelujah. Give him the highest praise. Hallelujah. Give him the highest praise. Hallelujah. Give him the highest praise.
Come let's pray, Jehovah. Come let's worship, Jehovah. He deserves the praise. Come let's praise him. He deserves everything. Oh, the worshiping. Oh, he gave me life. I will praise his name. I'm here to praise my God, oh, because he gave me life. Come celebrate, come jubilate, come to worship him. He deserves the praise. Hallelujah, give him the higher praise. Hallelujah, give him the higher praise.
Hallelujah, give him hallelujah. Give him the highest praise. Hallelujah. Give him the highest praise. Yeah. Hallelujah. Give him the highest praise. Ooh, hallelujah. Oh, yeah. Hallelujah. 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 Hallelujah to my Jesus. Hey, hallelujah. Sing praises to Jehovah. Lift up your hands and worship. Lift up your voice and pray. Hallelujah. I lift up my life for Jesus. I will worship you Yahweh. Hallelujah. Hallelujah. Hallelujah to Jesus.
About the scientific advancement of our society, Liberia, Africa, and humanity as a whole. Science and innovation are very important in transforming society. The fact that young people like yourselves in your generation converge because issues of science and innovation demonstrates your fast-actedness as you endeavor to see Liberia, Africa, and the world advancing in science, particularly Liberia. I want to thank previous speakers. I want to thank all of the participants in this conference, in this seminar. There will be challenges that you will face in your scientific aspirations. Science is not a fixed entity. Science requires patience. Science requires dedication. Science requires innovation. And many other characteristics. And that is why you will have to be overcoming cognitive challenges. Science also requires support.
Okay, good afternoon. I believe our guest is here, but I can't see his image. Dr. Dougbeh, if you are hearing me, for some reason, we still can't get your image. I'm not sure what's going on. If your camera is off, let me see here what I can get here on the screen. Are you there?
Yes, I am, and I'm in your studio.
Yeah, for some reason, is your camera off?
It's on.
For some reason, we can't get the image. It's dark. Do you see yourself on the screen?
No, I don't. I see it too. It's dark.
Yeah. So that means something is not stay right. So if you log in on a link, it will ask you to allow access to your camera and mic. That way you should be able to see yourself. Is that something you can try one more time?
We can do that. I did that earlier. We can do that again.
Okay, so let me just get you up. Make sure when it asks you to allow access to camera, mic, you okay it, and you'll be able to see yourself before you enter studio. So that way.
Sure.
All right. Okay, let's see here. Okay, Amos Joyce is here. Pa Joyce.
Yes, sir.
How are you today? How is Atlanta, Georgia?
We are here.
Okay, we are here. All right. Okay, so it's quite alarming. We just got new update from the Ministry of from the government of Liberia of the COVID. Is quite alarming. But while we wait for Dr. Nyan to come, I want us to take a look at the press conference held recently listen to the press conference held recently, a couple of days ago, when the Minister of Health, Dr. William announced that.
Liberians and all those are residing in Liberia. In consequences of the increasing cases of the coronavirus disease in Liberia, and given the statistics on the current spread of the virus in the communities, this mode of transmission and means of detection, the Minister of Health thereby announced a revised set of national COVID-19 guidelines. These guidelines are not much different from the ones we had before, but most importantly,
okay, let me just pause this here because our guest, there seems to be an issue. I'm not sure what's going on from his end. Do you have something on that, George? I'm getting some feedback.
Oh, yeah.
Okay. I'm not sure why the camera is not displaying the image.
Yeah, I can see him.
Yeah. Okay. No, that's the picture.
Oh, the photo. Yeah.
Yeah. So if it is difficult, then probably we'll just go with the photo. Dr. Dai, are you hearing me?
Yes, I can hear you. Can you hear me?
Yeah, you are audible loud and clear, except the image. That's what we're having a problem with. I don't know why the video is not appearing. That's the problem. So
yeah, at my end, all of my functions are open and allowed.
And the video here. So maybe if it is possible, we just use. I think you kind of like show your picture on that. Then probably we can just use that because I don't know why the video. Is it like a computer or the camera? Your webcam is on. The webcam is on.
No, it's my computer. I'm connecting with you directly from the link you sent me.
Right, and your webcam it came on too as well.
Hold on, just a minute.
I don't think the webcam. Okay, now we're seeing you. All right.
Yeah.
Now we see you. The other one, that now your error, right?
No.
Everybody get it.
Yeah.
Everybody get their error. Everybody get their error. Okay, let me just bring you in here. Dr. Dougbeh Chris Nyan, very, very familiar name. I don't really need that introduction, but every now and then, new viewers, new people turn in, and it's good to give them the benefit of the doubt. And so we get down to the real issue here this afternoon. First of all, thank you for honoring our invitation to come here for us to have a conversation, and it has to do with our country as well. So, which of course you've been giving back, so it's not a surprise to honor this information. That I thank you so much for being here.
Thank you very much for the invitation.
Okay. Okay. Let's have this conversation. Also, Johnny is our one of our contributors of Liberia Public Radio, Mr. Amos George. He's based in Atlanta, Georgia. Okay. Let's get this going here. It's unfortunate that we have to get a discussion going, but hey, it's part of the conversation. Here we are in Liberia. I just even received this morning from my guys. I update. Total 3,047, total death 95, total recovery 2,120. Active confirmed cases 832. This is more serious than we thought. So, what is happening now, Nda?
Well, currently, the entire world is in the stage of vaccination. Nevertheless, we did not ignore the fact that there are these variants that are circulating, the UK variant, the South African variant, and one of the most talked about one now is the double mutant variant from India. And we had anticipated that if necessary and requisite COVID-19 pandemic regulations, precautions that were not put in place and strongly implemented, even during the period of this vaccination, there will be an upsurge in certain jurisdictions. And we saw that in India. We are now seeing that around the world in many places. In Liberia specifically, when I was there carrying out the COVID-19 vaccination awareness on the radios and televisions and public health community programs that I had, we stressed the fact that government needed to be very cautious with the influx of travelers between India and Liberia, and that there was a possibility because of this interaction, we could possibly get the Indian variant or any one of those variants into Liberia, and that has come to pass. We are now seeing an upsurge, and it is my hope that the authorities have the necessary biomolecular tools in order to detect and diagnose so that we know specifically what variants are circulating. As you probably may note, in the United States, the Delta variant is becoming or is poised to become the dominant variant in the US infected COVID-19 population. That's where we are at the moment.
Yeah. Okay. Talking about the government have the capacity to deal with what is ongoing now. You as expert, you talk to people there. You went there. Do we, as Liberia, have that capacity to deal with what is happening now?
I will, from a technical, professional point of view, I would say no. Liberia does not have the adequate capacity to deal with an upsurge. I see that the situation in the country with respect to the pandemic response is presently going haywire and is confused. in Liberia, we have only one diagnostic laboratory for COVID-19, and that is the National Public Health Reference Lab. I am not sure if any other additional laboratories have been added. We in the past have proposed the need to create sub-regional laboratories, either in the Northeast or the Southeast, 2 or 3 that will be added to the current National Reference Lab. I'm not sure if that has been done, and to my knowledge, that has not been done. I stand corrected. Secondly, we do not have the diagnostic equipment that will enable us to mount a robust diagnosis, robust testing and tracing. We don't have that. And so among many challenges, these are the major 2 challenges that the government, health ministry, and the incident management system are currently confronted with and will be confronted with for a long while. The capacity also, the manpower capacity is also lacking. Frankly speaking, you don't have specialized infectious disease diagnostics experts in a country that can lead an effective pandemic response and control. And so if you look at the incident management system itself, it is headed and is manned predominantly by non-medical personnel and people who have practically, no or less public health expertise.
Is that not? Is
There
that
are a few of them around, but they are not at the lead in mounting this response.
so? That is that a non scenario?
I find it very difficult to comprehend because in various jurisdictions in the United States, coming right in the region, in Ghana, you have professionals who are trained in infectious diseases, professionals who are trained in diagnostics, laboratory scientists, professionals who are trained in public health response, that are the ones who are manning and who are the leads in the pandemic response in places like Ghana, in places like Rwanda, in Kenya. The Liberian situation is difficult to comprehend as to why that is not happening and that has not happened, although there has been numerous suggestions to revive the incident management system so that it incorporates this expertise. And there are a lot of them in the country. There are most of them specialized expertise in the diaspora that can be mobilized to help, just as Ghana, Rwanda, Kenya, South Africa, and other countries are doing. So it's a question that is yet to be answered.
This is quite interesting. Now, you giving a complete diagnosis and some of our shortfalls with what is happening within the health sector, and you are here. We have Dr. Nyanswa also here. So then the question becomes, what is going on? Who is not being proactive? Who is not doing what to get us to be at this point?
I can say for certain, and it's well documented, that the diaspora expertise have made every overture and offer to volunteer their services. You speak of Dougbeh Nyanswa, who was the head of the incident management system during the Ebola outbreak in 2014. You can speak of Madia Stone, who was there in the country. Myself, who participated in that response, and many others. There is also Dr. Abba White, who is here who is in the United States. He's an infectious disease doctor, a medical doctor, and several others
you speak of pathologists well trained, like James Elliott, Dr. James Elliott, and all of those who help who help the response against the Ebola outbreak are here in the United States and in other countries. Why the government have not called on them, even though we have made our offers free of charge, is left with the government of Liberia to answer. And this question has been posed by many journalists during interviews over and over. It is hoped that when they get these people who are mounting this response and government officials on their shows, they can pose these very questions to them.
So, can I be an educator guess? It sounds like political, more or less. It's a political reasons involved. What is going on? Because you as the experts and other folks here, and let me see here what I can make an argument to, because there are some things that we receive here as well. Some alignment, you did align in the past, and I'm wondering, I want to ask you why you decided to go to the bottom, top to bottom approach, in that you did not start with the Ministry of Health, Republic of Liberia. There's a letter you did to the Senate, pro tem Abachir, correct?
That's correct, yes.
So the first branch of government that is more or less political. So someone that is listening to us now will be wondering why Dr. Dougbeh Nyan decided to take the first approach going to Abachir than reaching authorities at the Ministry of Health. Why?
To set the record straight, the first approach was taken with the executive and the appropriate arms of the executive, meaning the Ministry of Health and specifically the Ministry of Health and the National Public Health Institute. That was earlier on during the outbreak of the COVID-19 pandemic. They were specifically written and our expertise were made available. Of course, there was not much of a response in accepting those offers that were made by several diaspora expertise, including myself. Instead, those suggestions and critical review of how the pandemic response was being conducted were responded to very, very wrongly by the government in attacking those of us, particularly me, just as you see Anthony Fauci was being attacked in the United States as well. These attacks happened parallel. I was being heavily attacked. And so when that did not happen, in our governmental structure, you will note that there is the health committee in either the Senate or the House of Representatives. And so the next thing was to contact the Senate and the House of Representatives to see if they could, these committees could have some bearing on reviewing the pandemic response, looking at all the faults that were exemplified and were revealed, that they could, ask the executive to rethink their directions. And that is why communication last year was written to Pro Tem Abachir and several other senators, including Senator Komine Wisa, Nyombli Kanga Lawrence, and at the time there was the former senator of Grand Crew County. He was also CC on that communication. That is why that communication was sent to the Senate.
So that was as far as detail made. That has been so. It seems, and I saw the tape here where you went to create a sort of awareness. So there was a line way ahead of time of this sort of traffic coming from India, to considering what was unfolding there. Why action wasn't taken?
Again, questions that I receive most times when I come on these platforms at your television stations to carry out this awareness are questions that are specifically meant for government to answer As you will note, every action that we have taken has been well documented, and in every country that we travel to. In Ghana, we carry out certain activities there, particularly organizing along with the Africa Bio Incorporated, which along with the Ghana Medical System and the Ghana Medical Laboratory Systems, organized a West African Conference of laboratory and medical scientists in order to very well focus on the COVID-19 pandemic response in the region and on the continent. After that, there was a letter sent to the president through the Ministry of State for Presidential Affairs, and indicating to them that I personally was prepared to come into the country and help with the COVID-19 vaccination rollout and other pandemic response. And I went in the country. There was no response to that communication. I was only told they have seen it and they will revert to me. I never got any response from there. And so I immediately set out to carry out a pandemic response, not doing things that I needed to do, carrying out activities, awareness activities on radio, on televisions, in the communities that I didn't need any permission from the government for, as a Liberian professional. And that is how I carry out those awareness activities. And as you saw in the tape, I have specifically warned of the impending traffic between India and Liberia, and between China and Liberia, the movement of people which had a propensity of having the COVID-19 variant in India coming into Liberia, and that the necessary precautions needed to be put in place. And we will probably get to that. And as you saw in the tape, I talk about that many times on radio and on television and in the seminars that I presented. Why nobody pay attention to that? I hope at another point in time, you will be able to get some of the Ministry of Health officials and government officials to answer such a question.
Well, unfortunately, usually for us, we like to keep our information proportional here, giving everybody the opportunity, and that's the little hair-scratching thing we've been having here at Lpr, hear from both sides, and not just to run with the information or see and just draw a conclusion, but it's unfortunate that people are not willing to maybe the one specific start of questions. I don't understand. I can't conclude to that, but we don't understand why people call you to get information out and it's not getting there. Now, this letter, your alarm was dated as far as September 2020. So it was something I believe you forecast that, hey, something potentially going to happen based on what you're saying, and you as an expert. So I kind of found it very, very bizarre for people who are in authority, and nothing proactive was done. People were relaxed, protocols not being observed, and I listened to the minister at press conference. For enforcement, they said the protocols are in place is not different than the first one that was instituted, except enforcement. So the question now becomes, why you did not even enforce it before? Because enforcement is the key. You said, don't open this door, and you allow people to go through the door. And you knew very well when that door is open, something dangerous or health issues will come about. And one thing I did not hear, and you said that correct, maybe we are in a population of 3 to 4 million. I thought the very first thing that would have come to the attention of the Ministry of Health or the government of Liberia to appeal to Uncle Sam, friendly government. Look, this is ugly now already. We are already in a double trouble. We need over 6 million vaccines to come here. We do not have the capacity. We need people to come and reach out to maybe some of you people. I didn't see it, and I'm hearing 3 feet. Social distancing? You want to go to Jogmantown Market, Rallytown Market to stop people? I'm not an expert, but it doesn't sound right to me. However, we are in a deep trouble water now. what can be done there? Is it too late?
When I was asked again whether we were out of the woods, that was on one of your sister stations, Cool FM, I specifically indicated no. The warning you talk about was sounded as far as September, and the latest was sounded just as early as April and May, early May, when I was in the country this year. I believe those series of warnings went out between the 3rd, the 5th, between the 31st of April to the 5th of May. And those warnings were sounded from my end that we could be getting the variants into Liberia if we are not careful. First and foremost, the implementation has been really relaxed. Government has been relaxed about this COVID-19 pandemic response. There have been a lot of diligent healthcare workers who have been working assiduously and performing their duties. One of whom I can admit to is Dr. Hazel, who even, late days heard that I was in the country and wanted to meet with me, but I was just leaving the country at the time, so we couldn't meet. And many others who are doing an excellent work in the response. But that is not sufficient if government regulations and policies are not commensurating with their efforts. Government is relaxed on implementation. The first instance of how you see how a pandemic response is being conducted in a country is when you enter the airport. At the Roberts International Airport, the first place of greeting or of entry is where the pandemic, COVID-19 test is being done. In that area, there was no social distancing, and I believe I sent those pictures to you. Mm-hmm. You saw there was no markings of social distancing. Everybody is just crumbled onto each other. And that was the first place I raised the concern that why are we not social distancing here? And the passengers, all of us that got out of the were asking, well, who is this guy? And right there, I began to indicate that everybody should stay 5 feet away, 6 foot away from one another. There is a gentleman who was on.
People front, are you crazy?
Yes, they found that very weird. They said, well, who is this guy? And there was one person who recognized me. If he's watching this program, we attest to that. One Ben Sowell. Ben Sowell told the other people that, that's his area. And so people started, at that moment now, started observing it. I said, use your carry-on bag to create a distance between you and the next person. So you don't see that. I will admit that when you go into the airport itself, after that, then you begin to see few markings, but which some of them are erased. I hope they can be renewed. The testing area is also another problem. You have only we saw only two testing booths that are handling about, say if a Boeing 737 lands, from Brussels. Can you imagine how many people are on a Boeing 737 that have to go through their testing? And so that is the first place you see that the implementation is not appropriate. It is not. The government is relaxed in that respect, and the response itself is indicative of that relaxed and uncoordinated aspect of the response. So right there, you see that the approach itself is less of a public health approach and is less of a scientific approach as we have put in place.
Okay. Well, being joined by our colleagues from the Morovia studio, Mike Dan is joining me here as well. And guys, don't hesitate if you have any question for the DA. So it seems to me here, the first defense line of protections against COVID, which is the entrance of RIA. What we know, when people come here, they got to, whether it's rapid or whatever, you have to go through that process, and that process is smooth, it's quiet because it has to be observed. Interestingly, our officials, lawmakers, whoever, these people travel out of the country and they go through this sort of channel, and I guess to see how organized those processes are. So now the question is that people that are there to implement, is it like incompetence? Is it they just do not know it, or they don't care? What sort of attitude is that, and why action is not being taken?
If you do a comparison in Ghana, for example, when you enter, there are people lined up to direct you to where you need to go. There are almost like 50 to 60 booths that are set up where you go in for an individual COVID-19 test, well demarcated. Before you even go there, if you didn't register on the app, there are about 10 to 15 to 20 in each section of mobile tablets that you go to. And then they direct you, making sure you keep your social distance from the next person. Although the lines are well marked and demarcated, but there are ushers, let's just put it that way, ushers, medical ushers, who direct you as to what to do until you leave and go to the immigration. That's not the case in Liberia. Like I said, you had only two booths during COVID-19 sample taking. Interestingly, the students that were in the booths were my students from Stella Marie's. And they recognized me and were asking, everybody asking, why do I have on a double mask? That's a very interesting question, because I was asked that question on radio when I appeared.
Was it true you had a double mask? Yes,
I had a double mask, and I made reference to the very variants that were circulating. And so in the United States, the suggestions came up from the National Institute of Health, based on consultation from medical doctors, scientists, that we need to even double mask. And so when I went throughout West Africa and East Africa, I was always double masked. And so this is the question. It's the question of how it is organized. It's poorly organized. It is not well implemented, and the situation is relaxed, or was relaxed at the entrance. And where are the travelers coming from? From different countries. And I will pinpoint India. Like I said, we are not really branding any particular nationality, but this is a public health response. As you will note, U.S. citizens were stopped from going to England. The English UK government stopped U.S. citizens from going to England when the pandemic was very high here. Even currently, the UAE practically banned travelers from Liberia entering the UAE. So I'm not particularly branding any nationality, but this is what needs to be done. And I will say that up front, you don't need to relax the regulations in terms of traveling. I will propose the banning of travelers from India presently, because that is the hotspot, and I suspect there where the variants may be coming from. So travelers from India need to be banned. Travel between India and Liberia needs to be banned. Not restricted, but banned, totally banned.
Needs to be banned. Let me go to my guy. And apparently, not just only relaxed, the process itself wasn't monitored as well. George, Emma George, and Mike Down. Do you have a question?
Yeah. Hi, Doc. How you doing? Doc, let me go back to the airport.
Mike, we're not hearing you. You got to check your system. Go ahead, Amos. We'll check your system.
Let me go back to the airport. When you arrive at the airport or you stay in the country, at the airport, is there any rapid testing? And if not, how are they going about doing the contact trace if someone is tested positive after they leave the airport? Is there any mechanism put in place to do that contact tracing?
I have really wanted to speak with health authorities there and authorities in the pandemic response. And as you will note from the communications which I sent them, I made myself available. The Deputy Minister of Health was aware of my being there and saw those communications. Now, it is not clear how the contact tracing is being currently done. There is rapid testing at the airport. And that is what I was talking about, where you enter the airport, you have to queue. And then there was not this social distancing, even when you are queuing. At the first instance, when you enter the airport, then you have to make your payment at a booth. Then before you go to get your swab taken for the rapid test. Now, the test, I doubt, is rapid.
That's why.
Why? Because the samples were only taken at the airport and you did not get your results at the airport. In contrast, or in comparison, in Ghana, you get your swab taken in those separate booths, and before you reach the immigration, within 15 to 20 minutes, your test result is registered with the immigration or on your mobile app. That's not a system in Liberia. So how do you know if someone has tested positive before exiting the airport? So if a particular passenger is positive and they exit the airport, they have already slipped through the cracks. That needs to be addressed. And these are the experiences traveling from countries to countries that we wanted to relate to our healthcare professionals in the spirit of professional collegial advice and observation and advice, so that we can correct the system. That's why we do in the United States. That's why we do in Rwanda. That's why we do right in the region in Ghana, in other places, in Kenya, etc. I think they should be open to that. So the question of contact tracing will be very difficult if a possibly infected person passes through the crack because they were not tested rapidly at the airport. Only samples were taken, but no results came out. The next thing is you leave the airport, you go to town, to your various locations, and it is said to you that you will receive your results. I never got my results that were taken of the test that was taken, or the samples that were taken at the airport. I want to be very clear here. There was no test done at the airport. There were only samples taken at the airport, which were the nasopharyngeal swabs.
Okay, break it down here for this is quite interesting, because one of my friends too came and said, well, I paid my money and I never got my test. So there's a second test and people are, so let's break it down to the lowest thing here, if there's some sort of equation to factor, if you will, here. The ordinary person that out there sample test, what is the difference?
When we say sample, and that is why I always like to speak in very, low terms. When we say samples, it means that cotton bulb kind of, ear cotton bulbs kind of thing that looks like, what you use to clean your ear. Yeah, that thing. We put it in your nose and we square it, we square it and take it out.
Right.
Yeah, and put it in a small little bottle that has some little fluid in there. And we break it up and screw it up. So that's what we call the sample. So that's what we are going to use to do the test. So when we say sample and test, that's the difference. You take that sample, and that sample is then going to be used to put through the machine and through the solution and all the little chemicals, and then put in the machine to now do the test, and the machine bring out the result of the test.
Wow.
That's how it is done. If we had, if we're in the other part of my lab, I would have shown you, the step as, just a simple step how it goes. But that's the difference between sample and test.
Wow. Mike Dan, are you okay now? Mike, we're not getting you. I'm not sure what I am. Okay. George, you got a question?
Yeah, let me go back to the government. That when you enter the country, and I know that you have people who work in the Ministry of Health and the National Institute. did any other people got in touch with you?
No, none of them got in contact with me. And the communications are public documents. They are available, and I believe you've seen some of those communications. None of them got in contact with me. And to his credit, like I said, just as I was about to leave the country, Dr. Jesus heard that I was in the country and texted me, found my number and texted me, and we exchanged texts. And it was just the time I was leaving, within those 24 hours when I was leaving. And he said, oh, I really wish I had seen you for us to sit and talk. And, you know, I said, well, I'm going, I will be in Ghana. And if there's anything, I could come back. During that period of time, I again contacted the Ministry of State for Presidential Affairs, specifically Minister McGill, asking him, what can I do to help? I am still waiting for a response from you. I have left the country and I'm presently still in the region in Ghana. I never heard from you for the 3 weeks that I was there. And I only got a response saying, contact me, call me. And I said, I am already outside of your self-coverage area. I am in Accra, Ghana. Use the email with which you are now communicating with me to say what the government's thoughts are about my offer. I can immediately turn around, depending on the arrangement, to come right back to Liberia. He said again, call me. And I sent him the same response again. And by that time, I was heading for East Africa and to return to the United States. So nobody contacted me. And like I said, to his credit, only Dr. Jesus contacted me just 12 hours before my departure, almost.
This is quite interesting. And before Pat George come in here,
Yeah.
I seen some level of politics factoring in here. You serve as an independent orator a couple of years ago. You have a critical voice, but with the intent to find solutions to what is going on. So is that, could one guess, is that part of it? Is he a politician? Is he a medical practitioner? Is that a sort of seesaw calculation people are having? Oh, but I think on the second part, before you respond, it seems to be a sort of pattern, not with only with this CDC government or governments in the past, their inability to distinguish professionals and put aside that, okay, this person here is not one of us. This person is not part of us. It has foregone, and it's like uncontrollable now. Is that a case?
I believe in this modern era, governments will have to be comfortable, or we have to learn to be comfortable with professionals who are versatile. I am an activist from my childhood through high school, through college, and I was still doing science. And so I grew up like that. I spoke for human rights. I spoke for social economic justice. I spoke against the war that was conducted, the atrocities that was conducted in our country over the 14 years. I speak against corruption, because if we have sufficient money that is not corrupted, we can pay more attention to health, education, agriculture, and other things. And in the process of that, why as a student of science and technology and a medical student, eventually, I was still an advocate. In my professional life as a medical doctor, trained as a scientist, I continue to advocate for those things as somebody who studied basically in a social democratic country and studied social medicine. So governments will have to get used to this. In other countries, you have doctors who are representatives, who are senators, who are presidents. So our government in Liberia, past and present, we have to learn to get used to this, that there are individuals who are versatile and there's nothing you can do about it. Once those people are committed to doing what they are doing, I gave attention to science and technology and medicine on the one hand in treating our people and the world. I give attention to advocacy for the betterment of humanity. I give equal attention to both. They don't conflict with each other. I don't give political injection. I give scientific medical injection. Just to put it as simply as that.
Yeah, this just drew my attention to something. What is your relationship with Dr. Kete? Because I follow you.
I have communicated on multiple occasions, and again, being at the health ministry and being in a position in which the minister is, I will anticipate that I will have good responses, but that has not been forthcoming.
Why are you think responsible for that?
It's a question that the minister needs to answer, not me. From my end, as has been documented throughout these times, I have made all of the attempts.
Can you make a guess, then?
A guess would be wrong. It needs to be appropriately and objectively analyzed to find out why the Ministry of Health, and I put the Ministry of Health and the incident management system, and the government of Liberia in a whole ballpark, so that we don't begin to pinpoint individuals. Why they are not responding to all of us that are making these overtures, not just Dougbeh Nyan, but Madye Stone, Dr. White, Stubborn Yuswa, and others, who are making these overtures. Why? We don't know.
Our own Lpr something who is an engineer, also has volunteered his services to look at the road infrastructure process, this and that. Interestingly, besides being critical, there are some serious recommendations, and I will go through them, especially calling for like an investigation, because part of that is not to penalize people, but to maybe perhaps to see what went wrong, and things can be fixed from the last COVID thing, and calling for some sort of a panelist or group, I believe that's professional people. So with all of that, all of those tons of recommendations, suggestions, nothing been picked out of there?
Nothing. And the letter that you referred to, which was sent to the President Pro Tem, as you will note, it did call for a panel of expertise to investigate or to review what was going on during the pandemic response. The faulty testing, the wrong testing, wrong diagnosis, ill functioning contact tracing, and the weaknesses and incompetence that was seen within the pandemic response. All of that needed to be evaluated. As you will note, in the United States, in Britain, and other countries, the lawmaking body regularly call on expertise to testify. And that's a way of reviewing what is going on in a particular branch of government. Because the legislative branch is more or less the oversight branch, that supervises all of these activities. So those committees in the legislature invite expertise and government personnel in those areas to testify. That is meant to evaluate the system. And it is quite striking that the letter that I sent was not given any attention. I also wished that those that were CC'd, that were copied on that letter, like Senator Nyobli Kanga Lawrence, and would, as one of the well-respected, advocates we have in there, would have taken up that issue. But again, I have no answers to that.
Yeah. Okay, I don't mean to sound ridiculous and hilarious here, but I'm not sure. I'm trying to make a guess game here. So it's the dear Senator Abachi. I'm just going to look at the subtitle here. RE request for Senate hearing or independent scientific committee to investigate blunder and neglect in Liberia's COVID-19 pandemic response and fragile health system. This war, is that something that frightens them?
It should draw any government officials' attention, particularly coming from somebody with the expertise. Why it did not shows a total neglect of the healthcare system, which is a mirror image of the total neglect of the interests and aspirations of the Liberian people in terms of their need for better healthcare, their need for a better economic system, their need for better education, their need for food sufficiency, and their need for a good governance system. That clearly shows the inadequacy in our own governance system. It shows an in-depth weakness in the governance system. In short, it shows bad governance. And these are things that we are trying to correct if Liberia must move forward. Liberia is far behind the rest of the world. From where Liberia used to be to where Liberia is now, it is unfortunate that our current generation, which I always term as the lost generation, because of that in between 14 years plus civil crisis we had, which disrupted the lives, some of which I spoke about as national orator when I spoke on July 26, 2016, which you mentioned. We need to give that generation an attention so that the year 1847 is not being misinterpreted.
Okay, I hopefully we can get a line here, because that's what we do here. LPR, we keep it proportional to make sure that people's voices are heard. And I'm so disappointed, not just only with the executive branch, the first branch of government, the Nyombi Kanga Lawrence, and all of those people here, because they are all major actors with this sort of communication. And she was seizing Kape, someone who potentially people that also want state power. And I never even heard one day that these people to have a conference, major conference, to say, hey, a son of the soil, the person with the expertise, this is what happening, and we government, we are not acting. I never heard out of that. All we hearing in that capital there is bickering, rationing money among themselves. Here we are after the feeling dividing 15K among themselves. And yeah, we're talking here now that the testing, we don't have the testing facility. Nobody is appealing to the international community. I don't know the thing, they're just going to just come and learn. When if you need help, you have to ask. So let's see here this Facebook. You say, Mr. So, I'm trying to see how to restructure what he meant to say here. Mr. So, please ask Dr. Nyan concerning the mechanisms our country need to venture into, so the country can be okay. I believe yeah, what sort of mechanism or what we need to do right now? I'm not losing hope, and hopefully they will not be stubborn to listen. What the trouble, we are already in deep trouble water. What needs to be done now? And I said, like I said, from the Minister of Health, I didn't see making an appeal to the international. America is not that tense again to say, oh, they have their own crisis. They happen, they were taking stuff to India, they're taking other things to country here. Now, why they can't ask? Why they can't ask for help?
It's quite striking why that is not coming forth from the requisite agencies of government, Ministry of Health, Ministry of Foreign Affairs, that they are not requesting, foreign governments or partners to come in. Probably they have done that, and we don't know, but that has not been anything that has been public knowledge. And so we take it from that point. During the Ebola outbreak, to her credit, Madam Ellen Johnson Sirleaf called out the United States government and Western countries. Here in the diaspora, as you may be aware, we had the Diaspora Task Force, which I headed, which then coordinated with Madam Sirleaf's government and called on the US government, which led me to testifying before Congress and laying before Congress the case of the Ebola affected countries: Liberia, Guinea, Sierra Leone, Liberia, Guinea, and Sierra Leone, and also Nigeria, because Nigeria was affected at the time. And we saw the import of international oil with various medications, logistical help, thousands of soldiers from the US, thousands of expertise from the US, and diaspora personnel sent into the country. We anticipated a similar thing could be done here. In this situation, you will need the Liberian government to utilize its various agencies that are responsible to contact various international governments. Although we have a pandemic on our hand, it is not an excuse to say other countries are having the same situation. How do we go to them? Well, our country does not have the kind of capacity to mount a response. We don't have the expertise, we don't have the equipment, we don't have the facilities. And so the countries that have the facilities can easily respond to their situation and bring that under control than we can do. So I believe the United States government is prepared to give Liberia the helping hand. I believe the government of the Federal Republic of Germany, where I was trained as a medical doctor, is also prepared. I believe the government of the United Kingdom is also prepared. I believe even some African countries that have mounted very good responses, like Rwanda, will be prepared, to send some level of help and expertise to Liberia. I believe South Africa, irrespective of its situation, will be prepared, because these countries have the structural setup that Liberia does not have. I believe Ghana will be prepared to do similar thing. And so the government needs to reach out. Why the government is not reaching out is the very question that we continue to ask. The government is not reaching out to its own expertise that are in the diaspora. And if it is not reaching out to foreign governments, it's a big question that we still need to ask. The mechanisms that need to be put in place is quite simple. Revamp the entire incident management system. Put in place expertise that have the requisite training to mount pandemic response. That means put in your system medical doctors who are infectious disease trained, scientists who are infectious disease trained and are specialized into diagnostics. Then you must have to also make the necessary funding available. The money is there, but how it is being appropriated budgetarily is what has been the problem. This is one of the things that I criticize. Now we see $15,000 being given to each legislature, whether it is the representative or senator. If you have 103,
every one of them received that.
Every one of them received that. But yes, mind you, in the past, one of my suggestions was the $30 million that was being sourced from the IMF for feeding program. I have suggested that the feeding program was not necessary because the people were not hungry. They didn't need to be fed. And it was not a question of feeding anybody. $10 million of that money could have been invested into the vaccine production, so that when the vaccine comes out, we will have a choice of what vaccine we want. We would have invested that into Pfizer or Moderna or AstraZeneca itself, so that then we will not be dependent on Gavi to source vaccines for us. So we would have had it much easier. That was ignored. I had suggested that take about $3 to $4 million and let us set up diagnostic centers in the various regions, southeastern and northeastern, so that they can add on to the National Public Health Reference Lab. That was ignored. The money that is being dished out now budgetarily, if that money is now put together, if it is returned by those legislatures and representatives and is put together, that particular amount, which totals about $3.5 to $4 million, can go a long way in setting up diagnostic centers, in paying the healthcare workers that are assiduously working to mount this response. It will help to mount an effective contact tracing. It will help to reorganize the airport area where incoming passengers are first received and the test samples taken. It will help to bring in other expertise that will add onto the diagnostic capability so that we have a well-oiled machine in diagnostics and in mounting this pandemic response. If that does not happen, as I predicted, we will be in much more trouble. That's the trouble we are in today, and they don't want to admit it.
Wow.
So the level that can we say the level of investment, I mean, response in terms of material, in terms of, for example, they said, oh, they're going to have XYZ provided for electricity. Instead of that, we should have invested such an amount into vaccine. This is why I'm trying to say that.
Certainly. First and foremost, the vaccine we receive, I doubt it can even cover 1/3 of our population. We receive anywhere from what 200,000, to give and take 200,000 to 300,000 doses. I'm just giving an estimate number.
No, it was 96,000, and we are told that another 96,000 and 60 plus thousand is expected this week.
That is correct. I was trying to give the total quota they want to send to each country, but they are sending it in incremental stages. That Gavi wants to send, in incremental stages, and that is where we are. The vaccines came into the country. The vaccines were there. The vaccines have expiration dates. You need to start immediately, even before the vaccines enter your country. You need to you will have already put in place the rollout mechanism or the tier of citizens or population that will come in the various stages, first, second, third. All of that needed to have been worked out. Yes, something was worked out, but it was very confusing. Number one, the public health awareness exercise was never carried out.
That's it.
Those in
Liberia, this is another problem.
Those in Liberia can attest to that. Your studio manager in Liberia can attest to that. Up to the time exactly. Up to the time that I got into Liberia, there was not any much public health awareness going on. What is the vaccine that we are receiving? And mind you, our people are well knowledgeable. They know that there are different types of vaccines: AstraZeneca, Johnson & Johnson, Pfizer, Moderna, or Sputnik 5, and the one being produced in Cuba. They know they are the various vaccines. We are getting AstraZeneca. The question was, why are we getting AstraZeneca and we are not getting Pfizer? Those are the kind of questions that trigger on the minds of people. Then the conspiracy theories came in also, that, well, they are only sending us vaccine to kill us Africans. This was a pervasive conspiracy theory in the population, which I uncovered and I addressed during my vaccination awareness program in Ghana and in Liberia. So these are things you needed to address. Tell the people we are getting AstraZeneca. From this age to this age group will be qualified to take the vaccine, so that you don't just say, come and take vaccine, but who are eligible to take the vaccine. So all of these things needed to be put in place. That was not the case. When I got there and began the public health awareness exercise on radio, I may use your platform to really thank OKFM, KISS, Cool FM, Truth FM, and Joy FM, that help you also during the initial stages to carry out this awareness. I want to thank all of you. We did this awareness, and the questions that came out suggested that Liberia is not unique in its conspiracy theories, and it is not unique in the hesitancy to take the vaccine. And these have to be addressed. And these are questions that I addressed. And he will admit, people now started, journalists and others started going, they say, I'm going to take the vaccine. I'm now going to take the vaccine from what I heard from Dr. Nyan.
Look,
the other day, and to just come in a little bit of fun. So the other day I was reading a document from South Africa wherein over $5 million was invested into public information awareness,
That's
so as to
correct.
educate the public about the importance of the vaccine and other awareness issue relating to the COVID-19. But in our country, there had not been, I don't know, on the COVID-19, on those donations that were made, I don't know, on the budget line, on public awareness, there were little done actually. As a result, the conspiracy theory, like you say, is too huge in this country. For
Right.
example, when the Madagascar health came, there were huge celebration because people thought that this was the cure for COVID. Yeah. So there have been I think
To that point,
yeah.
good you brought in the Madagascar quote unquote COVID organics. And that was one of the points where the government came against me. I had advised the government not to bring in the COVID organics because it was not scientifically tested.
It was not scientifically tested?
It was not scientifically tested. In the
Even
and I
before
said,
Liberia, WHO had said that no, it is not a cure for COVID.
exactly.
Before Liberia and Togo accepted it.
Right.
And
And that was given a rare carpet welcome.
Yeah, by the president.
Yes.
But when the vaccine came in, there was not much publicity or education about the vaccines, which are scientifically tested. So you see the disparity in how the Ministry of Health and the Incident Management System and the National Public Health Institute have been handling the response.
Let inside the public.
So there is a lack of the scientificity that needs to go into the response. There is the lack of the actual public health epidemiological tools and knowledge that needs to go into the response.
So,
and there is much of a mixture of the ill political and policy will to implement the proper things.
So this is I don't know. There are some doctors you call, even like Dr. Carter, who is the chief. I believe he's still the chief medical chief medical officer. Now that these people, they are all professionals, right? So it is in their jurisdiction to tell national government things that are lacking, things that are needed. And sometimes when we listen to hearing, they don't prioritize basic things. You look at, even so you go to national security, the police budget, we say they want to fire armed robbery, and then you have their budget to be on $1 million. And they're seeing very people, the first branch of government, they are rationing money among themselves, and leaving the health institution, seeing workers going on strike for not getting pay or being unpaid for different. Are they not telling the executive branch of government what is real, or are they not just being honest? So then what is lacking? Who can we hold responsible?
Well, again, when I even gave my critical review of the importation of the COVID organics before it got in the country, I have also indicated that if the Ministry of Health did not properly advise our president not to accept that COVID organics, then the Ministry of Health is to be held responsible. That we can always hold President George, we are responsible for things that happen because he's president. And that's why he has these ministers around him that should professionally guide him. So if the Ministry of Health did not properly guide him all through this time, I am asking the Liberian people to hold the Ministry of Health responsible for the pandemic response, for the importation of the COVID organics, and for the lapses in the pandemic response.
And the irony about it is that at the welcoming ceremony, they told us, we journalists here in Liberia, that This was a free donation. It was a donation from the government of Madagascar. Unfortunately, there was a committee hearing recently. There was a committee hearing recently that the Minister of Health was asked, and then we spent the government of Liberia spent 71,000 US dollars to import this COVID organic into Liberia. So this is the irony about it. We don't know who's talking to.
The fact that it came from the Minister of Health, who is the appropriate government functionary that we are supposed to get information from, we can take it for being true. And my understanding, as I read in the papers, is that she was rebutted by, one of the
the Minister of Information, Lejo Reni.
Exactly.
So where's the coordination?
And this is where the contradictions always come in. This is not the first time it has happened. This 2 statements, 3 statements coming from one government has happened in the past. For example, with the $16 billion issue, with the $25 million mop-up exercise, and we see that also now with the pandemic response, whereby there have been contradictory statements. The official who is responsible for the health ministry appropriately informed us as a public and other expertise that we spend this amount for importing the COVID organics. The Minister of Information comes and rebut that. The issue of transparency is a very major question that still haunts most of our governments, and is today haunting this government. You see, in pandemic response, there's something we call public health transparency. If health workers, health professionals are not open with what they are doing, that we are not, if we don't tell you that AstraZeneca has these reactions, including blood clotting, if we don't tell you that and that happens, we are not transparent. That is why you see those information came out from us. Where did it come from? It didn't come from the press. It came from the scientists. It came from medical doctors. It came from public health personnel, us. We look at that and we say it has these reactions. So let's be careful with how we administer it. And then we put in place the necessary mechanisms. So if government can be transparent in the same light, much will go on and it will make our work easier. But because governments are not transparent, it makes our work difficult. It creates the conspiracy theories that we hear all around. And we don't have the money to mount the public health awareness because the money is being diverted to other things that are not necessary. So at the end result, the population, the common people suffer. Who's dying now? The ordinary citizens in West Point, the ordinary citizens in Suniwen, the ordinary citizens in Logan Town, the ordinary citizens in Douala, and all of these slum areas where you have congestion. And of course, the ordinary citizens in the upscale areas as well are dying. It's the population that suffers if you have bad government policies that are not transparent and that are not going towards the interest of addressing the root causes of what the problems are in society. And so just of our people who are running or putting themselves out as candidates already for being presidents tomorrow, these are areas that they need to concentrate on. It's not just criticizing President George Weah. All we see is just this consistent criticism. George Weah is this, George Weah is not, George Weah is this, George Weah is not. But we are not seeing any policy, well-defined policy guidelines coming out from them. We are not going to buy another pig in the bag, no matter how golden you take yourself to be.
Can we say that government to come will have some serious challenges?
It would be more than George we are.
In terms of since you are in the health, we narrowing down the health issue.
No,
In
but
terms of public health issue.
You know, and we say this always. Public health cannot exist properly and cannot function properly if you have bad public policies. If you have a bad economic policy, if you have a weak economic system, public health and any other sector of the society will not operate effectively. That is the interconnection between science, medicine, technology, and politics, and political economy, to be specific. Because it is the policy decisions that drive the rest of what takes place in society. And so if these things are not handled, there will be multiplicity of problems, healthcare problems, agricultural problems, economic problems, and social problems as well, as we have been facing. So it will be more than what President George Weah has now. What is in place in order to present an absorber for that shock when it comes? We haven't heard that from any politician. Not one opposition, quote unquote opposition politician have put that forth. And this is where we have to be careful, because post-pandemic, there will be problems. During the Ebola outbreak, we as expertise predicted that Ebola is not going away. If anyone heard some of my comments, I said Ebola has a permanent residency in the region. It does not need passport to travel anywhere. What did we see just recently? We saw an upsurge of Ebola again.
Okay, let me go to this number here for a caller here. Caller 443 number, are you there?
I am here, Mr. Stoll. Good afternoon.
How are you? What's your question?
I'm doing well. This is Sandy from New Mexico.
Okay, Sandy, welcome.
Thank you. I do not have a question. I really do have a comment. I've been following what the doctor on the show has been saying. I apologize, doctor. I couldn't catch your name. But I want to first thank sharing your thoughts and expertise on the ongoing health crisis that we have in our country. I do have a background in healthcare myself. I am a healthcare administrator by career. Have a master's degree in environmental health science, and I do have a bachelor in medical laboratory science. So I do understand some of those issues that you were addressing. I want to point out, and I agree with you when you say Liberia, our government, some of our government leaders are not willing to hear from expertise or other professional, or even call on them in times of need. That's a big problem we have in the country. I do believe that we have two major issues in the country affecting all of us. The first thing is a systematic issue. We do not have a system in place, a real strong system in place to address crisis like what we have. I mean, it's a known issue. It is not hiding. Everyone knows that. And little is being done to address that, to put into a place a system that will help us overcome some of the challenges that we have in the country. Another issue we have, and this is part of what you address, is what I term a culturally embedded pride that we have in Liberia. That's where government officials are unwilling to even consult people that really know the issues. Like you, a doctor. Why won't a government a leader or government official or our leaders be willing to consult people like you, or reach out to other leaders, other professionals in the healthcare and ask for their expertise or ask for their help in this time of need? So until our leaders can really overcome that pride, where they believe that when they are in position, they know everything, and that when people volunteering their services, they believe that people are trying to overcome them or try to overshadow them or overpower them. Until they can get over that we will continue to suffer. Our people will continue to suffer. So, I mean, I'm not going to ask you what we need to do to address those things because you said a lot already. But I just hope that our government will continue to listen to ordinary Liberians who have certain expertise, a professional background, and are willing to help our country. So thank you again for sharing your thoughts. And hopefully, people will reach out to you and others so that we can get out of this crisis we find ourselves in. Thank you.
All right, Sandy, Mr. Sandy, thank you so much for such a beautiful impact into this program. Let me go to Da.
Yes, sir.
Listen to the young man. He's my junior brother as well. Listen to the young man. So this is it's an established fact. People know it. So why? I don't get it.
And from what the young man said, it is a validation of everything we have been talking about. We are not alone in this approach. To see our countries. It's not just Liberia. The African continent. When we take a Pan-Africanist approach, we want to see Africa getting out of the dark ages. And it will have to do with inviting the expert knowledge in the various sectors of our society to move our countries where they need to be in order to contend or to compete with the Western world. Nowadays, we have all of the educational basis, we have the technical basis, but why is it that those in authority continue to ignore what needs to be done in order to move our countries forward? It's a question. And that is why this advocacy will continue. And so when they see versatile or professionals like myself, who will not only talk science and medicine and penicillin and COVID-19, but will come to the actual political economic analysis of what we are going through, they find it, in their own world, find it abhorrent. But that's what it is. Every society has conscious amount of people. They don't necessarily need to be politicians, but they are always advocates in their own ranks. You have economists who are advocates. You have lawyers who are advocates. So too are medical doctors and scientists who are advocates. And we'll keep advocating for a betterment of our society.
That is it fair to ask these questions that a lot of people are compromising their profession probably to protect their positions, jobs, and government because they have a responsibility. If you are a medical doctor, you are there. Whether you were appointed by the president, that's not the president's area. That's why you were called in to help the president in making informed decisions. We don't know whether he or she, they are opening up to the president or anything the president says is yes, and they are first, and when they say no, maybe they will lose their job. If that is the case, then we have to question their trainings, their disciplines that they are going through. And I quite agree with you because Qatar, I think they need to cry. And it is a disgrace on the part of the government, the opposition. See what is happening right now. See what is happening right now. And all of these people who are running, seeking for these big, fabulous positions, nobody is putting out anything strategic policy-wise. That's why they don't even have advisors. They're supposed to be having medical advisors. They're supposed to be having engineers and other people to lay out their agenda. But it's nothing. They say it, and there are people tear them out because they want political dividends in return.
The appetite for power far supersedes the interest to address the fundamental weaknesses in our society in terms of governing system, our governing system, in terms of our economy, and of course, now we are talking about the healthcare crisis with which we are faced. There is a lot of mediocrity that is saturated in our society. There's a lot of sycophancy that has engulfed the fabric of our society. And it goes to the extent of saying a lot of people have compromised their ethics. And we are seeing that being exemplified. With all of the critical assessment that I gave when I was not in Liberia, and on radio, people were saying, if you come in the country, will you be able to say the same things you are saying? For example, you say the president shouldn't take the COVID organics. I said, yes. If I were, you know, advising him, I would say the same thing. Well, recently I went into the country. They said the man can come and help. But then I went there now to help. And nobody called. Right. So at least I went there and made myself available, free of charge, not coming to take anybody's job. If I said, you assign me, just tell me what to do. I will follow your directions. And nobody said that. So again, for those of our people that are running for offices, we don't want these empty promises. We don't want these big elephant promises. Give us exactly what you think you can do. We don't, as our people always say, and I will repeat, we don't want to buy another pig in the bag. Our Liberian voters should open their eyes wide and wide this time around. Not everything that glitters is a gold. Something can be a crystal stone glittering somewhere, but it is not necessarily a gold, it's not necessarily a diamond. We have to be very critical. We have to analyze those who are putting themselves forth to become our next leaders, who are putting themselves forth to replace President George Weah. What have they done? What sacrifices have they made for the society? What have they done regionally? What have they done globally that have directly benefited the Liberian people? What have they done?
Let me go to the line. I will come back to you here. Hello, Mason, are you there? Mason, are you there?
Yes, I'm here, Mr. So.
Okay, how are you? Go ahead. What's your question?
I'm good. Thank you, Doc. I've been following and I've been listening to him deliberate. I enjoy his deliberation. And I agree with most of his concerns except one, where he said people should stop criticizing the president and holding the president responsible for the ill advice of his lieutenants. Doc, if you went into the theater to perform a surgery or a procedure and something went wrong, which your nurses, which one of your nurses or your nurses called, will you not be held responsible as a doctor? I said this from a drive-by guy. It's the president who appoints these people, and if these people are not qualified, he should be having them changed regularly until you find those who are qualified to perform the duty. So if we will hold anybody for whatever thing is wrong, we got to hold the president because we did not elect these people. These are people he appointed. According to him, they are the cream of the crop that you find from the Liberian people. We are asking him to give us the cream of the crop, and these are the people he's giving us. That's why we criticize him. That's why we hold him, because this is what he's saying is the best. So when you say we shouldn't hold the president, it becomes an call for me, and it becomes a confused pattern. So can you clarify what you mean by we shouldn't hold the president for these people that he kept in the position for over the past 3 years that cannot deliver?
Thank you very much.
That's my major concern.
Okay.
Thank you very much. That is a legitimate concern. And when I said that, you go back to the tape, there is a disclaimer that I said we cannot, I think I meant we cannot always, just hold him responsible, because there are these expertise that are around him that are support. President George Weah is not a medical doctor. You know what I could hold President George Weah for responsible presently, directly? The failure of sports in the country. Are you getting what I mean? That's something he knows very well. although he has a sports minister, I mean, I'm just giving this analogy, but
Right.
in terms of the economy, in terms of the pandemic response, it's not just getting a patient in your clinic. A pandemic response, when you hear epidemic or pandemic, that's a totally different level of medical crisis. And there are these people who are supposed to have the expertise that should advise the president on that. So if they are not advising him, my thing is that given the level of mediocrity and sycophancy we have in the society, we should call these people out and not just only calling out the president. Because then it seems that we try to exonerate them. Oh, President George, we have got the COVID organics. We got the COVID, but who made him to bring the COVID organic? Did they advise him not to bring it and he did it? That's the question we need to be asking. So that question falls on the health ministry. If our foreign policy goes wrong, like for example, with the Middle Eastern crisis that went on in the last 4 or 5 weeks, Liberia has had a major role to play in the creation of Israel. We have very good relationships with Israel. And there were crises in that region for a long time. Those who know the Liberian history in 1947, 1948, at the UN General Assembly, when Liberia was instrumental in those processes. So when there is a crisis there, Liberia has always been, importantly playing a role. Liberia has a foreign policy role in the crisis in the Middle East. During the Dougbeh time, during the Toba time, during those times. So the question becomes, why is it that Liberia was not even saying anything about the crisis in the Middle East? Do you blame the president immediately? Turn to the foreign minister first. And that's the spirit in which I was talking, that we have the expertise to do these things, but they are not doing them. It's not that the president will not be held responsible, but ultimately those who are responsible should be held those who are responsible for those should be called out. And I also call for them to be changed if they are not performing their duties.
Okay, Doc, can we also say that the issue of competition, because because the president appointed some of them based on their profession and their qualification, by they accepting some outside advice, and I mean, but they rejecting some outsiders' advice. Do you think they are afraid of competition? Because many of these people coming from outside who are not partisan, quote unquote, of the ruling establishment, sometimes they are just there to undermine their job, unquote.
These are the political intrigues that we really need to evaluate as a nation. In previous governments, in previous administrations, the governments recruited to the best of its ability some of the best expertise we could find, whether they were in any political party or not. We saw some of those semblances in the legislature. We had even opposition, quote unquote opposition politicians being represented more than the government that was in power. Now, there is a lot of incompetence in our system, in every sector of our society. And we need to address that incompetence by putting in place people with the requisite expertise in order to mix with those who are on the ground or within the country in order to transfer expertise and transfer knowledge. That has been my particular aim and objective. Not just going into the country, volunteering to do this, to do that, but in that same process, transfer scientific, technical expertise to my fellow colleagues so that doctors are also trained to have scientific investigative mind. So that medical doctors, just like I am, you go for a medical doctor and then you are a scientist at the same time. That I want for us to train more of those kind of people. That is why we see in the West, for which their system is so superb in terms of medical response. That is what we need to do in our countries, in Liberia specifically. And so this is meant to train people in that direction, to train people into diagnostics. So it's not meant to come and take somebody's job away. You know, I just hope those who are of this kind of perception will get to think. When I get there are things that I can learn from also. And I have always said that. Those are my colleagues who and I talk most times, like Dr. Benetta Collins Andrews, she will attest to these things. There are things that they know that we also need to learn. We are from different jurisdictions, you know? So there are certain techniques, there are certain things that they know that we also need to learn, and we are open to doing that. It's a cross-fertilization of ideas. That is how science flourishes. That is how medicine flourishes. That is how technology flourishes. That is how we get more food. And these are the things we want to do. We don't want to come to take anybody's job away from them. That is why I say I'm coming for free, meaning that I don't even want payment from you because I can sustain myself. All you need to do is to create the atmosphere where I go. Since you have your government cars, you don't expect me to go and charter my own car to carry me to the office and bring me back, or take me to a region to bring me back. I think the government has that, can make that kind of availability. Since I have my house or my properties in River G and Sino or Kepamas, and I'm in Maryland, I'm from Maryland, or I'm from this place, I don't have a place in Monrovia, then government can provide a place in Monrovia for me. When I say me, I'm not saying directly I do, but whoever.
Yeah, who wants to help.
Exactly. So these are the little mechanisms that they need to put in place. But if you take $15,000 as an appropriation budgetarily to carry out quote unquote constituency engagement, which is a kind of broad thing that you can't put a pen to. But I tell you, right? But I tell you, when I was there and conducted the awareness and the diagnostic testing or workshop at the LRBR when Dr. Fatima Bole was still alive, may his soul rest in peace. We needed anything from $1,000 to $3,000 just to get few reagents, chemicals to put together and do the practical work that we couldn't get. So imagine if we had that $15,000, we could have trained just in that period, trained about 100 diagnostic technicians, and I'm just saying 100 as a mark, but more than that, of diagnostic technicians in a particular procedure.
Wow.
But that is what somebody is going to use for quote unquote community or constituency engagement that is not defined. So again, they miss messages and they miss appropriation. That I will count as a misappropriation, and that is corruption. So both the legislature and the executive are all trading these misappropriating acts, and who suffers? The common people suffer.
It's actually on purpose. That's why we decided to make it a law, and that's why sometimes we're having this conversation. Listen to the brother here. That's just another justifications of these people wrongdoing. Yes, we say president. Okay, he's the president.
Right.
Even if you are opposition as well, you want to come to state power. When the government or when the people that are in authority, when they are doing what they are doing. If you are doing similar thing, then what is the difference? You just the same. You are not making no difference. All they are doing, people, their followers, their supporters, back in then, Helen did it. You didn't talk. This one, so it has become like a visual cycle, and that's what we want to be going with over and over. They're not coming with no policy, no any plan. They're not coming with anything. I'm sick and tired, and any other rational Liberian sick and tired of Joy. We are wearing 50,000 shoes. Some year two are doing this, this, and that. You need to come up with something tangible that I would say, okay, I think I need to go in this direction. But when all of them behaving the same thing, when CDC people wearing red barrel, and then you article COP coming with their own black barrel, and then you have Liberia People Liberation Party coming with green barrel. Then I feel that they also want to be like in the same shoe of Jefferson Koji, because you are not drawing a fine line to say this is what the people are doing. We are not for it. See who we are. Nobody is setting the map. So that's the problem we are in. I'm not sure what we're going to get out of this. Yep, that will soon let you go because we want to have you in the future. Pajo, you want to come or you want to?
I wanted to take that back to something he said earlier in his opening statement. You did mention about people, non-medical personnel being placed in medical area. And that has been one of my greatest concerns. What do you think is responsible for Liberia? I mean, we're in the 21st century. Medicine is not just something people can just go tomorrow and come back and say, I'm a nurse or I'm a doctor. Why the government of Liberia is putting non-medical personnel in medical area? How effective will these people be? Do they understand the language of that area? Secondly, you talk about the mistesting of people, result being given. I want you to elaborate. What are the factors responsible for people giving people different results and missed results? We know something it happened in the Western once, maybe in 1,000.
Right.
But when they become prevalent in the country, like Nigeria, then it's a serious concern. So I want you to talk on that issue for us.
The giving of missed results or false results or wrong results could largely be due to multiple factors. It could be due to the lack of the requisite expertise, the technical capacity, the technical expertise to conduct the test, the lack of the proper equipment to conduct those tests, the lack of the appropriate reagents, which are those chemicals, solutions that we use to conduct the test, and the misplacement of priorities in general. Yes, we have, sometimes in the West, we have what we call false positive results coming up, but they're very rare. And if that happens, it's not prolific. But in our situation, it is a condition that is very alarming. And we had that repeatedly being experienced during the course of this pandemic. We can only hope, in order to correct this, that the government, through the Ministry of Health, through the National Public Health Institute, can put in place the corrective measures, which include bringing in the expertise, the requisite expertise that can conduct actual scientific medical tests. Now we are at 95 deaths and 3,047 confirmed cases. Who know how many other cases are out there that we have missed, that are running through the cracks because of the lack of proper testing capacity? So all of these things need to be given serious attention. In the earlier stages, I have proposed to the government that I could come in, bring my team, they provide the materials and other things, and we can develop Liberia's diagnostic testing kits. We have the technology. I have the technology. We've made this technology available to Liberia and the West African countries. None of them have come forth. Only Rwanda has shown interest, for which I'm always in Rwanda, in East Africa. The South Africans also show interest, but the Liberian government never took that on. And yet we have these false tests always coming out, and we have to depend on the West for testing kits when we can do that ourselves. The same thing with Ghana. There's a colleague of ours who is the head of INCAS Diagnostics, who also developed a rapid test for COVID-19. and the Ghanaian government has been giving him the runaround. The Ghanaian government preferred to bring in a diagnostic test that they will pay for almost $30 million, then giving Incas Diagnostic of Ghana $5 million to develop, the test on a mass scale and make it available to the Ghanaian population and the Ghanaian testing facilities. So you see, it is a systemic problem. As I said, these problems are not unique to Liberia. They cut across countries and cut across borders in Africa. And we have to address it as a Pan-African contingent of patriotic, nationalistic, the nationalism in a good sense, and well-meaning citizens of these countries in order to have our continent moving from a backward stage to a stage of progress. If you can recap your second question or the first question you asked, I will appreciate it.
Oh, I said that the misplacement of, the misplacement of non-medical personnel.
I'll take it from there.
Yes.
You talk about the misplacement of misplacement of personnel in the first place.
Yeah.
This is something that we have brought to the attention of the government long time ago. Why is it that you will bring a pen driver to fly a 737
jet?
You're gonna hear about it overnight.
Let's just put it very simply. That is what is happening in our system. I will just leave it at that. So unless we can find a trained pilot that can fly the 737, and mind you, Liberia had trained pilots for, and I go back to our lost generation who think Liberia is just where they met it. No. Liberia had trained pilots. Liberia had Air Liberia.
Yeah.
That ran from one county to the other, and ran from in the neighboring countries.
In the cycle there, the yellow plane.
Right.
For the color.
So we have I just meant to say we have the expertise all around, but how they are appropriately placed in the various functions is what is boggling us. We have had that situation in the last regime. We have that situation now. And I hope we don't have that situation in the future. I hope we can address that situation in the future. Bring together our best minds, like Rwanda has done. We and Rwanda had the same crisis, the same period of time.
Yeah.
And look at where Rwanda is today. Look at where we are. And I can compare the two countries because I'm in the two countries back and forth.
But
so before
but that you don't think people are saying those in the government circle that Dr. Nyan is too vocal, so we cannot bring him around. You don't think that's some of the problem?
There's a voice to add up to that. Don't some address A here. The guy said he's an activist, so we can place it in the column here. Is your voice too extreme for these people? Is there any way that we can abuse it? Okay, maybe. And I think it's a couple of things here. People are in fear.
Yes.
The mayor and the other group that the mayor know when you can't, will not get no chance. I believe they get that kind of category of people. He will be bold to tell the president. He will be bold to tell people. So we always have these kind of dishonest people who are not really, I consider them dishonest, because if you can even sit with the president, I'm not saying in cabinet meeting you should raise your hands, Mr. President, you run, no. But after meeting, you take phone call. Even though we were in the meeting today, Sarah, but this is my expertise as a Minister of Health. Mr. President, this is based on what I know or other things that I look around to see. This is wrong. And before you respond to that, because talking about this Madagascar stuff here, we had a conversation here, and I was upset in that what these people did, they even endangered the life of the president. It does not want the president to go and receive that thing. Come on, give me a break. Why you have the chief medical officer? Why you have the minister of health? people drinking water bed, we don't know, and you allow the president
to come.
to go there. It could have been an explosive. I don't get it.
And you remember on that particular show, like you said, you reiterated my concern. I said, I'm concerned about the health of the president.
Yeah.
You know, why would they sit there and allow that to come in for him to take? And they were just, the sad part about it is that the National Public Health Institute was providing justification for the importation of an untested, unverifiable formulation. So we have to be ethical. Those ethics that we learn in medicine, in law, we have to apply them. Where our major function as medical doctors is to save life, not to harm life, according to the Socrates oath. And excuse me, the Hippocrates oath. Okay? So we have to stick to that. And ethics is one thing. I came up with my invention because I invited criticism. All those who work along with me in my lab assistant, the laboratory personnel, the research assistant, we sit every day and review experiments. Where did we go wrong? And everybody come in and give their critical analysis of that experiment. Where did we go wrong? What did we get right? How can we move it better? And they criticized me and corrected me in various respects that led to my invention.
Wow. Okay.
And mind you, some of these kids are high school students that I trained to perform the very procedures. And come and say, Dr. Nyan, I don't think I did this like this, but from what I did, from my experience, I think we should do it this way. You must always be open to suggestions. It will take us far.
Wow.
Always be humble. My lab personnel, the high school students, you know, they call me Dougbeh, they call me Christopher. They don't call me Dr. Nyan. We call each other by our first names.
And you accept that. And that's the problem.
That.
Our people,
it doesn't change me.
We believe
some people call me, some people refer to me as Mr. Nyan. I don't correct them because I'm Mr. anyway. We
believe in title then function. That's the problem we have in our society.
Right.
Honorable Doctor, Your Excellency, this and that, and all of you know. It reminds me when I came here in this country at Newly. It's so funny before we let you go. First place of assignment, you know how when you get your boss, you have to do this, minister, so. So when I did it for the first time, the observer, the second time, the lady said, but you don't need to call. I said, what are you talking about? I don't want to lose my job. He said, is that how you do it in your country?
Right.
And I took a deep breath. Should I say yes or should I say?
So I said no.
Should I say no? Should I put my country under the boss? I said, well, out of respect, we always do that. He said, no, it's not necessary. Just call me by first name. I'm like, wow. You don't even have to speak to me. You come just do what you want to do. Can you imagine walking in your boss or minister office in Liberia without you say morning tea?
Yeah.
You might be out of job.
It's a big issue, really. Yeah. if you did that.
So before we let you go, this is a serious business. We are already bridges already over the troubled water. What can you do? Is there a way that you can still appeal to your government? Is there a way? Because I listened to the minister press briefing and few things that I jotted down. I believe you are listening to it. 3 feet distance, funeral wake only 20%. Nobody go out of the country. India, Pakistan, Bangladesh, nobody coming in. Mandatory mask, social distancing, 3 feet, and blah 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 blah. School gonna open, but they're gonna observe it. Is that a practical solution? Is that a practical and solution to what we get our in considering this number here that we're just looking at? confirmed 3,047. Not a single county, as far as I'm concerned, that is out is of it. So that's just the number. When media people report this sort of number, the possibility of being quadrupled is
Right.
most likely.
Right.
What can we do now? The problem is there. So what's the solution now?
If you will note, the pattern of this virus is such that the infectious pattern of this virus is such that you know, there are carriers who are asymptomatic and are silently carrying the virus in the communities. What we need to do is, number one, to reorganize the incident management system. If you don't have the right expertise to mount the response, you can say all of the same regulations, parrot the same regulations that other countries are doing, you will not move forward. Because why? It comes to the issue of implementation. Then, a second leg to the implementation is strategy. There's a lack of implementation and there's a lack of strategy, strategic approaches as to how to implement the very regulations.
It's a huge work, and the people play.
And these are simple things that can be handled only if there is the policy, administrative, political will to address the situation by changing that which is not working. So we can talk about the 4 feet distance, 6 feet distance. We can talk about the wearing of masks. It is not being enforced, and there is not a strategy to enforce it. So we need defined strategies for enforcement. And those details can be discussed with them if they need us to talk with them. Because some of these things are real technical approaches, you know, that you can just come on radio, you know, television, right? It's sound out. It requires collegial discussion, exchange of the minds. So if they are ready to reach out, the other hands are available to stretch out.
Wow, that's a critical question. Yeah, and the conspiracy theory is all adding to this. It's just unbelievable. And I've been calling him, and I'm giving him the opportunity. I'm going to call him the Solicitor General of the Republic of Liberia to write that people that are taking the vaccine, they will die within a specified time.
Who died?
It's in our chat room. Councillor Serena Cephas.
Serena Cephas?
And even giving news on top of it. You as a Solicitor General that nobody should administer this vaccine, nobody should take the vaccine. So I'm wondering now, is that a reason why they are not calling on the international community to get but calling together? But here the minister is saying they're going to be giving the vaccine. So which of the vaccines Serena Cephas is telling us now? And you are a chief prosecutor of the whatever you say, whatever the president knows about it, the government knows about it, it becomes official. You're not like me, you're not like ordinary person. So this is the problem that we have, this sort of a lack of coordination. Right. It's a serious problem. So
we faced the same situation during the Ebola outbreak, when one of the senators said the Ebola, that's a lie. This thing the government just doing it to get money from the international community. I mean, this made the initial responses to be very difficult. Because right there, as a government official, top government official, you have already created a blockade in the minds of the people in accepting the reality that is unfolding. The pandemic or epidemic reality, infectious disease for that matter. There's the same thing you are also referring to. There have been mixed messages And it does not do well for the population in terms of the awareness. It makes our work to be difficult. I just came from in the country without any government support and pleading with the population to take the vaccine and address a bulk of the conspiracy theories that were surrounding the vaccine, particularly the AstraZeneca that we have in the country. And people started responding. So to hear such a thing makes our work very difficult. It adds to the situation of the conspiracy theories and how, you know, the people are now hesitant to take the vaccine because whatever the big man says is what they go by. We saw the same thing in the United States when the former president, you know, was the chief proponent of these conspiracy theories.
Yeah.
And you, in the United States, you see what we are faced with. He was not a proponent of mask wearing. He said it was not necessary. So in many states, many people, you know, it became political. Quote unquote, red states were not promoting the public health regulations.
I know.
And blue states were promoting the public health regulations.
It's a
So
challenge.
it's pretty much the same. And that is why I continue to say objectively that these conditions are not restricted to Liberia. You know, they cut across borders. You have these characteristics of people all in our countries, whether it's in the rich countries or in the poor countries.
Right. And
we have to address it. But in our situation, it's worse because we don't have the capacity to mount these kind of responses to counteract these statements.
Yeah, and the proliferation of the mainstream now is all over the place. Now we're talking about the government. This and that. What should be our own responsibility as ordinary Liberians, as citizens? What should be the common sense techniques now we should deploy as well?
Right, and again, in all of my social media postings, or public health awareness, I continue to admonish our people, please wear your masks. Africa Bio Incorporated, headed by Ms. Candice Eastman, that organizes major scientific conferences and diagnostic diagnostic activities in West Africa and Africa now, and myself and many others have been one of the chief proponents of mask wearing, that Africa Bio produces its own masks in Liberia. I was one of the first scientists who proposed that mask wearing must be mandatory when there was still the debate as to whether, you know, globally masks should be worn or, you know, masks should be only left with, you know, the medical professional. I said everybody should wear masks. Even our African prince, you can make 2 masks, wear one. When you come home, you wash that one and put the new one on and go out. In the earlier days of the pandemic. So I continue to propose and stress the wearing of masks. Keep away as much as possible from other people, particularly with the situation that we have now. If you are not from the same household, you must keep together. Stop the major gatherings. These big sports gatherings or parties or, you know, or social gatherings have to stop. The quotas in schools and churches, we proposed that long time ago, has to be reduced. But again, how are these regulations being implemented? How are they being monitored? So it is the implementing, monitoring, and strategic aspects that are lacking. And that needs to be done. So to our Liberian, West African, and East African, and people who are listening to this television cast, please wear your masks, wash your hands, sanitize your hands with those little sanitizers that we carry around. Keep a distance from others. And most importantly, we are in a vaccination stage. Therefore, go and take your vaccine. The fact that you are not sick now is the appropriate time to take the vaccine. So go and get vaccinated. Once we have enough people vaccinated to create what we call the herd immunity, meaning plenty of people got vaccinated so we can break the transmission chain. It will help the communities from the infections being transmitted and spreading in the community. I advise our government to, I'm advising the legislature to pool those $15,000 that each of them got.
Yeah, man, I finished school and thing, and what we going to do now?
Pool it and let us use it for pandemic response. This is the major crisis we have on our hands now. Giving some of the money to a local health, county health authority does not cut it for us. It has to be a major national designed, coordinated response and not an isolated donation to a local health community or authority. It will not do much. It requires a national, coordinated, effective response. And all of this decision is in the hands of our government. President Weah can act on that. He can refuse to act on that. I hope he watches social media as well and listen to these broadcasts. We are here to help you. We are not here to do anything. All we want to see is for this country to move forward, for us to go out as Liberians like we used to do before, for us to go out as Africans like we used to do before and be proud of our individual countries. This is what we are looking for. We want to say, Roberts International Airport, as soon as you get there, you can see the distancing line. You can go immediately within 5 minutes. You can get through with your registration. You can take your sample, and then you go make your payment. Within 5 minutes, you are out. It shouldn't take 2 hours for somebody to get out of the airport. These are little things that we need to do. And we want to come to advice, but where you don't want to listen to us, and we are questioned by the population because the population knows they have the expertise. Why the expertise not coming for? Then we say it out in the public. So it's not meant to query you. It's meant to rectify the situation. And that is why the United States and other governments have what? Public hearings. They criticize themselves in the public.
No, with the 15,000, no hearing about that. But just all sort of things. They want. My man told me, said, one of men from Bon County, I try to call my people there. I know, is it Bon County? Man, finish digging. I know he's digging well or whatever. I mean,
the other woman said she went in school. They went big blocks.
All right, that we
need to change the system. We need to rescue Liberia and take it from it. We need to rescue Liberia. We need to reinvent Liberia. We need to rebuild Liberia. So rescue Liberia, reinvent Liberia, rebuild Liberia. That's what we need in the next 20 years.
I'm looking who's going to really put that forward here. Hashtag, yeah, okay. What, Dag, one of the funniest sons of the Republic of Liberia. It's good that you guys are not giving up, and we're not going to give up on this whole thing as well. We're going to keep it in the mainstream. We're going to keep it in the talking point. Our job is to talk about it. They want to accept it. That's fine. And I'm so happy because I saw those footage creating that awareness, sending us signals. Unfortunately, nobody listening, and here we are now. We want to thank you so much for your expertise and what you continue to do for our country. And you're flying our country flag and what you continue to do for the world, not just only the country. Now, that's what happens when you do not realize and knows the importance of your own, and other people make use of it. Yeah, Uganda now, he going in and out. So if you have one of your own is doing it, and you don't want to make use of it, then those who know the importance, they go away. Dr. Dougbeh Chris Nyan, I want to thank you so much for your time and your expertise here at Liberia Public Radio.
Thank you very much.
We're looking forward to having you again when the history change and when anything improve. please come and let us know as well. Then we can also get it out there within the public circle. Thank you so much.
Thank you very much.
Yeah.
Thank you very much. I appreciate it. The Lone Star forever and Viva Africa.
Thank you so much.
Thank you, Dad. We welcome you. The team both in Liberia and then the US welcome you anytime as always.
Okay. All right. Well, folks, there you have it. We gotta go. Do you think people are gonna bring that? Nobody gonna bring that money back. That money been gone.
No.
But the loan always, Alfonso, the loan portion of it is been rejected by the Monserrato County Health Team. This is a problem. The loan money is.
But that's what that's. It's not a issue of Monserrato. This is a national cause now. First of all, there is no justice.
He's from Monserrato, so he gave it to the Monserrato County Health Team.
But that's how. Yeah, you see, that's narrow. That's a very narrow thinking there. They don't have no cause to even take that money. It was a disgrace. It was a disaster. No justification ever. Whether it was put there, Helen Johnson's time is a common sense that people should apply. So then I'm not sure because their argument now is constitutional. They put it as a law because people who put it there, whether they are there or not, they should be there. And now I'm not sure because Monitor Spoon, whether Omen Boyka also spoke to that and all of that because it was only as whether he ever saw that, whether he heard it, and if that was the case, what did he do? I heard him talking about to audit what George Weah government. Okay, that's fine. Nothing wrong with audit.
Yes.
Is he going to go back to party? Huh?
Yeah, I think from what he was saying is that
go back to his own United Party where Helen Johnson Noka went bankrupt and she took responsibility and nothing Liberia will not compensate her. She walks away with a $5 million from the Ibrahim award. And then so what is it? I want he to also take the bull by the horn, like what Tanzania now. The city vice president, Mokafili, died, and she calls for the audit of a very government that she's also work as a vice president. We Joseph Boyga gonna do that?
No, Mr. Soya, what happened? I listened to portion of the interview, and I was very interested to listen to portion of it. They asked him that question: is he going to call on the law because to return that money? He dodged the question. He said that the taking of the time of the money was not right, but if people can take the money and give account of it, that's why it's important.
Those are political statements because they don't want to hide their base. They are not brave. They play to the soundbite of their people. So this is a clear indication that these people, they are also, there's no different from what CDC is doing because they do not want to hide their base because if they did, these people are going to turn or flip up on them. That's what he's doing. So Alexander Kumi is right on that. And now they are slamming, they are bashing, he's being lambasted heavily because Kumi is telling these people, you take the money, and they don't want to do it.
Yes, and
that's a disgrace.
And that was the question I would have followed. I thought Spoon would have done by saying, hey, your rival call on people to return the money, and you are seeing that the money, the timing was not right. So in other words, Honorable Boyka is saying he got no problem with the money. That's why he's saying. How can you say
exactly?
Yeah, how can you say you talk about accountability when people are saying the money is for them to be used at their discretion? How can you account for something?
Who's gonna ask them?
Yes.
People paying now. People paying people school fee, people doing this, people doing that. Seriously?
And the most of the thing I heard something funny, but I had not been able to authenticate it. They said that the president called the director of the team and said they should give the money back. And they said they had some hesitancy, so they said the Ministry of Health instructed the team to give the money back to Senator Dillon. But I had not been able to authenticate that information. So that way,
here is the bottom line.
Yeah, it is true. It is true that the Minister of Health asked Dillon to take his money back because the money, according to her, it has some political stuff surrounding it. So as such,
and they are right on that because he's giving instructions. He's telling them how it should be used. There are two things. You can be in two places at the same time. If you want to take it, take it. You don't want to take it, don't take it. Don't act like you, okay, I'm not taking it, but I gave it to you. This is how I want it to be. So on whose supervision, whose action? You can't do that. I mean, that's just it's wrong.
But Mr. Tro, here's the thing here. The money was given to us in the day long. And someone have said that the money should be returned to the national coffer. And the Ministry of Health, she got no power to tell the health authority in most of our country to return the money. If at all, because the money was given directly to them by a senator, she got no business, because that's the institution, the senator's responsibility. If you get money to them, but what someone are saying is that the money should be returned to the national coffer.
Yeah, how it works here. Yeah, how it works here. We saw that with Stone and all of these Trump people.
Yeah.
The money didn't go back. What they do is they found
private
organizations, non-for-profits, a humanitarian organization. That's where the donation go. They will determine how it's going to be used. That are you who, because the reason you're not even taking it, you know within yourself, in your own right conscience, it was not a right decision to do.
Blow back.
Yeah. So those sort of monies, when they're giving it, they give it to the people and they turn their back.
Yeah.
Because they know it's almost like they turn their back and they determine how the money should be used. But you can't take it and say, "Oh, I want you to do it this way." It just doesn't add up. I mean, honestly, that's how it is. Let me see. I don't know what this question.
People must give it. They must give that money back to the national coffer. All of them should give that money back. Period.
Hello.
That's robbing the Liberian people.
Hello. Yeah. Hello.
Okay.
So now, what is going on in Liberia now? How people?
Well, Liberia is cool. It's just that the COVID issue. People are like trying to mask now that the new variants, quote unquote, the new outbreak, and death continue to increase. Though it's not as compared to other countries, but at a certain level, deaths have been occurring, and the number of cases are increasing gradually. Howbeit, Liberians are going by some little tips. Every now and then, health tips will come, and then they are going by it gradually, though.
You get mask?
Yes, I'm here.
No, I said, do you have a mask? No.
Yes, I have a mask here. I've been masking very seriously.
Oh, okay. Yeah, because
are you going to take the vaccine?
I want to see that mask. Let me see it. Let me see it again.
I've been deciding to take the vaccine.
Okay, all right.
I've been deciding to take the vaccine.
You know, we can't be the other people. We want be dog. You want be cat. Yeah, don't be. You can't tell people to do it, and then we don't have.
Yeah, you say what, Max? You're not deciding.
I've been deciding to take the vaccine, but hopefully I'm going to take it. Yeah.
Don't be like me. I got slammed there. I learned the hard way before I went and got it.
I'm fully vaccinated, and I will talk to anybody to take it.
I think we just want let people take it, let government create it, because there are some other people who might not even afford with the transportation. So I'm wondering, I heard the minister was giving places, but what's about the elderly, senior citizens? Yeah. What is playing in those community? Are they going to take it to them, or people going to drag their old ladies and they put them in campaign and all of those stuff with the traffic and all of that? We just want them to create an atmosphere, maybe community-based, it will be smoothly administered, because I'm telling you that virus, you don't want to experience it. If you experience it, you will know exactly why it is. I know it treated people different, some people 1 day, 2 days, but hey, you don't want to go even that route. Well, guys, so we're going to be cutting down. I want to thank all of you so much, Mr. Dan, Pajoy, as usual. I want to thank you, and of course, to our many viewers and listeners following this podcast. This is Liberia Public Radio. If it's your first time, just go to that bell sign, click on it. There's going to be a drop back. You want to subscribe to all notifications, and that way you get an alert when we are on. That's very much important. Like the page, and we try to keep the news proportional, fair, balanced, and objective. We are
definitely
invitation to the government, the Ministry of Health, our call yet to be returned. So we have to discuss. Bringing these people is another way of contributing to our quota to our country, give it a good conversation, have a discussion, and that they will be able to do what is best. Until then, gentlemen, have a pleasant afternoon. Mike, you keep the mask up and do what best for yourself. Have a pleasant.
Thank you. Thank you also, Mr. Panzo. Thank you.
Abliju be moy be hure ti blanka jira ke na won britanji be ngen de para ro bochen ba webe wara corona virus ke jiji we da da bira muni no o je ke we ma corona virus ke o se penyi nwine o da ba ku ke ona nyo private ba woro nkana na ke o je ke webe ma corona virus ke da be nyi twen ke mo ni jo yu wa brin son be ayi nyoni ke nyi ko ni pra o ke nyi san ni pra ni me jo yi ka be de ro da pa nwe Menje de diyan ben ginin ke kwa menyu wana ka jenyo ke kwa mo igwo nyu ka be na blike de du yin mo yin benge de to be o benyu benge wana ke bengo yi blanye bengo mbuchen o kinki mo monda benge nyuru mo kwanyi tode soni mo de suike nin mo yin drian kwai boti sembla juke nyi fie bo mu ke na le soni dre kwai nyi dero yi pon ni me dre kwai o kwin mo we sembla ke ti sembla ke me dre kwai boti pra kwin o tani mo monda benge de benyo pra po ye bengere mu o nyeni mo ne son ke me ba wen juke nyi ko mu o nyi san ni o munyo ke mo monda benge ni mi memero konne o ni mi no ji meke nyi ku o je monda bengo ta o bengo yidu bengo di se paren sa igu de ba ke nyuru o ji fiba blen o ji yo wa be na wo je nyuni ke yi ka tre ni be pa pide mu wura be ni ta to be o wa ko mu monda be ro mo bengo ke bun fwen cha ke juke de ro jiji debe panton be mu oble fropa be koni be mu be ko komna nyobe o nyobe be wa ne penye be ko wa bo chenwura ne zuwo bamba mi bodu toje botina ka mu pona ka debe so nye omode Ministry of Health program robo ke mu
anye pokra wa na wura wa mu sonati na ji na be amplede de na ji be amplede mo kwete omone ojira kuno ambo kwela o dratu nye pojudu akwarati o patu nye pojudu te o police na o gba wa kuno amu wo Onyina mo coronavirus kan ye nu odade ne kwera o se kureko ajira ba obo fon ne ma be o ji mpona ne na kokure ne sho kparem ja na fora mu ne sunu ne tine du anti na shanati e ma be na jira be tijira de kuro ba nu ka na woro ne na woro ye mara ne puam no kunya ne kuti ne be plerem de ne ba nu o le shawa nkpon krabro akpo Kia kwarati onena brokpo ete akomba repeti po ne o shankpo jisa dembe nura mo botunyi po yidu kwatutwe ema be mu dere mo ton detenya ne ji ne woto kwe tiwe woto wa kwe wona kwe na bi woto wa wo kare esha be nita semre bi bombo ti troneo ema be fufonye po yidu ifota troni boti bore fufonyo nyempape ne ema be Najira be kukure mo najira be sha ne pokwa wi na sha ta na kukure ndo wure on se tunye po yuduti bubulale nime o mena puru bo nya tuntun mo bo didie po nya kwagbe o ma me ko na gba dero tu de bele mo prosun blekri yo de po e ma be tunye boju o foran shone noja mo ti karembe in o fo se shonu ne wura ka na po piteti yo Botunye po yudu boti kwane ebe tene nyingbe no nyatina buenunu ne emabe je nyingbe ore osha otane anera osha okon ke owurara oti ne aprere anye fo pore iniane tane anera ne bioti jira de kote owurara tiyo ne puse na pam to wacho na ba ti ko bam no kunya pokreti akri se tipo sara e de tamwa Ministry of Health e moi kenwa anya piasra
Welcome ambla kaunga twae
Ulo kpangang age kupala kapo kumuka. Yi lono iplana crofry yi nyawo apanwe ngabo dakama coronavirus. Coronavirus anu pai ngine kwa tamama. Coronavirus ka crofra yi nyawo anu so kwala mlimitama. Ega bunu fama. Ega nuye ton, ega nuye tiho. Tena ya marake ge koponga gabekele age crofang tahupa kulwa ngamba enu raso. Aga mage ya ge ya betu. Ge ye ton iwo to poma anele menga ba moi ipela de kema. Ye kula van kema. Gre ga banuma ye kula ma hu van ka kanda ka van ka. Ye yinga wa akporo da ya ten kreno ya kwela li lo kema pa dobosi. Ba ma aga ya yila sanama igron jamvule ne ye yinga wa. Ninga chukraba yinga wa no atenke kle. Ifole ponju benu tamaka nai ifole na. Ya ga ba ton iye plela ya ga ba ti hoi iye plela. Iwala swapoma yi yo kro jambai pama iwo swapon kana to loy iwo je yo me akanu da kpunu afama pama nu da awaka newe anele mane age manu ti ele sapela de salte bona nui kova kamai iwo siegwa nu na paka kwesu yi v ananu pore kanena age nu ngadu me krong plana manu ti ma kase ka wotoy ngulo apaka po akrai nukulu yinga de ka jalme kre ngundo library siba yi da kada minister of health.
Well, that's it. That's how we're going to leave it here for the rest of the evening. We want to thank you so much. We all have to create an awareness of this. The virus is deadly. It has no boundary. It's no opposition, imposition. I like this party. I do not like this party. All of us families back there, this sort of it is alarming with this sort of number of cases already in the country. It is very, very scary. 3,047. If you look here, confirmed cases, bombing, Bon County, Bapulu, Grand Basso, Grand Cape Mount, Grand Jide, Grand Cru, Lofa, Mangibi, Maryland, Mosurado, Nima, Riverses, River G, Sino. So it means this is the update from the government of the Republic of Liberia of the cases. So it means nothing is off. Nothing is off. All of the counties are currently bent their issues. If that number is reported, it means it's more than that. There are so many ways we can do it. We want to have this sort of message in the various vernaculars so that the message will it will resonate, because when you speak your dialect, when I speak the Crown, you speak the Bele, the other person speak the Manon, the Gio, the Vai, the Mendi, the Gisi. People will listen, and people listen to us here in the diaspora. And I'm not saying necessarily this work here, but we also need to call our families and tell them, because sometimes you tell the people, I mean, they time off business and I inside. It's wrong. It's because of the information that they get out there. It's not doing them well. If you want your voice to be part of what is going on, to give back to your country, you know our WhatsApp number. You can record your voice or audio. Just tell them a little about the coronavirus, wash hands, keep the social distancing, use your mask, always keep yourself safe. You want to do it in your dialect, you can send that audio on our 682 number, and we can put it out there. I mean, that's another way of giving back to our country. This is a number, the LPR number is on WhatsApp. Do it audio to create an awareness. You know, what people should do to keep themselves safe from this virus. And we will play it here. And the credit goes to you because you are contributing to your country as well. This one is no collaborating party. It's no rainbow party. It's no a CDC business. It's everybody business. Right now, it's we've been heard one of our colleagues in the media, formerly with the ECOWAS radio. I don't know yet about what we've been hearing past, and most likely it's because of this. And there was potential breathing problems. There was no oxygen. So imagine, God forbid, if there's a serious outbreak, we all would be devastated. You have your families, loved ones, friends. All of us have people back there. So this one is a national cause, and we must all rally to do everything possible we can not just on the government, not just the opposition, but we ourselves also, by calling our people and telling them what to do. They must listen to us. They listen to us when we call, when we talk to them, and we have that tolerance and patience and tell them, hey, this is how the danger of the danger of this. You tell them, because you here, you in America, you in Europe, you Asia, or whatever it is, we have seen it vis-a-vis. Our experience is ugly. It's not nothing to make friends with. As an enemy, we shouldn't condone that, and we must encourage our people. Please do all a favor, record in your dialect and send that to us, and we can play that. It can be used as a public health awareness to the people. You know what it means when they hear your voice from the US, from Europe, from Asia? Oh, I heard so person voice in this dialect, in Bele, in Gisi, in Minor. That yes, we should take this seriously. We should take the vaccine. We should avoid being in a crowded place. Then we are saving lives in our country as well. Then they will take us serious. We shouldn't just pluck fingers in the eyes of leaders when we are not even willing to do anything for ourselves. We are not willing to advise our people. When we are only telling them that God for all, everybody for themselves, then that is just unfair. In order for our voice to matter into what is happening in Liberia, we must be able to have a calculated mind to tell them, don't go this way. I experience it. I seen it here. Don't believe these people. Take all necessary precaution, because if you don't do it, they will call you, and you work hard. We all work hard for the money. We have to do all the best we can to save life, because the life you save will be your own or that of a friend. Until then, folks, have a pleasant evening. Thank you for taking of your time to be with us. Send in your suggestions, your comments as to how we can improve the conversation here. If we are doing it the wrong way, let us know. And we can fix it. You know, our microphone is open. It's not just only to the elite, to politicians, anybody who wants to share something that's worth lifting to Liberia. Come and we can have that conversations. Just have a taste scheme, because people going to disagree with you, and just have that tolerance, and that you can overcome it, because we are all in it, and one person can do it. Until then, have a pleasant afternoon, to evening, to morning, to whatever you are. Thank you for taking your time off to listen to us. It is important that we have this conversation, but these conversations must be conducted with civility, so that I can listen to you, so you can listen to me. You can cost me, and then you expect me to sit on a conference table to come to a solution. It doesn't work that way. That's not how it's supposed to be in this 21st century. People who lack of voice, lack of wisdom, the ability to make things work, engages in that. And I think it's just unfair to have that. It's like you have somebody on your shoulder, and then you conking, knocking, beating your head. They're going to throw you in the river. And that's not what we're supposed to be doing. Have a pleasant evening. Bye-bye.
I just want to thank you. Thank you. Thank you. I just want to thank you. Thank you. Thank you.
It's the time to come together. Keep Liberia safe forever. So open up your heart and let the unity begin. Love is all we need to make it stand. Let's cultivate one another. Learn to live together as brothers and sisters. togetherness, we won't have no peace of mind. Unify and have a peaceful, sweet Liberia. Land of liberty is our home. Keep it standing. This is the one and only home that we have. Sweet Liberia.
All you have done. If I don't thank you, I will be so ungrateful. What if I young? Tato efemo. Tato nyeso. Wole konyo. Thank you, Lord, for all you have done. If I don't thank you, I will be so ungrateful. Thank you, Jesus. Wole konyo. Tato. Hey, Tato. 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 Kaya wayo. Apart from you, there is no other God. Every other God, the soul so counterfeit. I tried Juju failed me. I try every other God, and they all let me down. They all say I should give something for something. Let me up on the sacrifice before they can bless me. Who says I met you? You never asked me for a dime. You keep on showering your blessings all over me. If I don't curse you, if I don't worship you, what's that much to pay? You can't make that up. Tato, hey, Tato, 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 one kind of warrior.